3 things that you never say to a grieving mother. I know that when someone you know has lost a child, you want to be helpful, but you're scared to say anything. You don't know what to say. And many people don't say anything at all. Don't do that either. This video is to help you kind of understand how to speak to someone who has lost a child and what to say instead of also what not to say, right? So I'm Christy Bundakumar. I'm a psychiatric nurse practitioner, but more importantly, I am a grieving mother. And the first thing I want you to never say to a grieving mother, what happened? It's the first thing that comes to our mind. We want to know what happened. But think about that for a second. That's selfish. That's your curiosity to what happened. You're trying to feed your curiosity. It's not helpful for that person. And oftentimes, there's a lot of complication, both emotional, mental, spiritual, around that question. And that mother probably hasn't figured out all of those things. And so they're going to tell you, a story of the actual death, right? But how is that helpful to the person that you've asked? It has fueled your curiosity, but now you're internalizing, could that happen to me? Right? And in that moment, I would need you to try to make it about the person who is grieving. So try not to ask that question. I've asked it before. It's been asked to me. And in my case, it's not a simple answer. I mean, I could say, they had a rare genetic disease that they passed from, right? But it's so much more complicated than that. And so try not to ask that question. But if you do, just move on from it, right? A better question to ask, tell me about your child. Nobody wants to ask us that question. They're afraid to ask us about our child because our child is gone. But we want and we need to talk about them. What is their personality? What were they like? What did they like to do? How they died is the pain. How they lived, we can find joy. And so instead of asking what happened, say, tell me about your child. And they may tell you how they died because maybe that's what's on the forefront of their mind. It might be what they think you're asking. But then redirect and say, okay, tell me about them as a person. And I often get this when someone's child has died of substance overdose. They'll just say that. Oh, they overdosed. What a negative thing to leave the conversation with, right? And mothers need support, but when we get into these awkward questions and answers, it can often just kind of stop the conversation. And so when, I always, if someone answers with the actual how they died, I'll redirect and say, tell me something about your child. What are the favorite moments, the favorite parts of their personality? They want their child's life to mean something, not just their death. So that first never, try not to ask what happened. It will come out in the conversation, right? Try to focus on the child, the positive aspects of the child. 2, the second thing you never ask is, how are you? Especially right after a grief. I mean, we literally want to cuss you out when, 3 weeks after my child dies, you say, "How are you?" And, I'm smart enough and insightful enough to know that you are just trying to be helpful and you're trying to start a conversation. But we are not okay. Now, as time goes on, we are okay and we can be okay. But especially right after grief, do not ask, "How are you?" A better question would be, what are your thoughts right now? What is going through your mind? Because I can tell you, you will get a different answer every time if you ask that question. Because some days I truly am okay. And I'm thinking about the positive things and I'm growing my life around that grief. Some days I'm angry as hell. Some days I'm sad. Some days I don't want to talk about it. Some days I have this whole spiritual thing I want to tell you. What is going on in the mind of a grieving parent is not a "how are you?" It's not a simple question, but it's still simple to say, what are your thoughts? And that opens up to having that conversation. Oftentimes, when you say, "How are you?" you're just going to get a, "I'm okay, I'm fine, I made it to work," right? It's a superficial question answer. Whereas if you ask about their thoughts, you can really know how they are, right? And some days we're okay and some days we're not. The third thing I want you to never say to a grieving mother is, "I understand." I have lost 3 children and I don't say that. I understand pain. I understand grief. But I don't understand your pain, your grief. And there is something different about a mother losing a child. And I'm not, putting grief on levels. But, when I studied like attachment bonds and continuing bonds, and there is a physical connection starting in pregnancy through birth that is chemically bound by oxytocin, not just the genetic connection and the emotional bond of being one with another person. And so regardless of your pain, because we all experience grief, and you want to be a support to this mother who has lost a child, but your pain of grief is not the same as their pain of grief. And we can't ever say to anyone, "We understand." I talk about this in the Mentally Strong Method when we thought map something, right? Like our childhood and things from our past make our pain unique to us. And when you tell someone you understand and they feel like no one understands, you're putting up that wall. Because then I really can't share anymore with you. Because I can't, open up that vulnerability. It's okay to talk about grief and pain. I have many people in my life that are support to me who it was painful to lose my children. My best friend lost her mother. We can talk about grief and pain, but we don't want to ever say, "I understand." And even part of that, I've had people come to me and say, oh, well, I lost my dog last year. I understand. Please do not compare a mother and child bond to your pet. And no disrespect to that emotional bond, but it kind of cuts off our ability to be real and vulnerable with you. So what can you say instead of I understand? You can ask, is there anything that you can do to help or support them? You can ask them, do you like to talk about this? Do you want me to ask again? Right? There's some people in my life that I might say no to, right? Professionally, if one of my staff that I don't spend day to day with, or one of the patients, I probably don't want them to ask on a regular basis, right? Because it creates this awkwardness. But somebody I work alongside of that we're also friends, I'm going to say yes. Please ask me again, because I want to talk about my children. And that's me. Everybody is going to have a different response, and don't be offended by their response. But asking them, instead of saying, oh, I understand, say, how can I help you? Do you like to talk about these things? And putting the power and control into the grieving mother's hand. So just to recap, don't ask what happened, ask about the child. 2, don't ask how they are, ask about their thoughts. And 3, don't say you understand, just ask how you can help.